Hi everyone, welcome back to my channel. Today, we're going to talk about something that affects over 500 million people worldwide, and that number is still rising. Yes, we're talking about diabetes, a condition that often goes unnoticed until it's already impacting your life. If you or someone you love has been diagnosed or you're worried you might be at risk, this video is for you. We're breaking down everything you need to know. What diabetes really is, the warning signs you should never ignore, how it develops, and most importantly, what you can do today to stay healthy and in control. So grab a glass of water and let's dive in. What is diabetes? Diabetes is a chronic health condition that affects how your body turns food into energy. Normally, when you eat, your body breaks food down into glucose, a type of sugar, and releases it into your bloodstream. When your blood sugar goes up, your pancreas releases insulin, a hormone that helps glucose enter your cells to be used as energy. But in people with diabetes, this process doesn't work properly. There are a few different types. Type 1 diabetes. This is an autoimmune condition. The body mistakenly attacks and destroys the insulin-producing cells in the pancreas. It usually appears in children or young adults, but can develop at any age. People with type 1 need to take insulin every day to survive. Type 2 diabetes. This is the most common form. About 90 to 95% of people with diabetes have type 2. In this case, your body doesn't use insulin properly. Over time, it can't make enough insulin to keep blood sugar levels normal. It often develops slowly and is linked to lifestyle factors like poor diet, inactivity, and being overweight. Gestational diabetes. This develops during pregnancy in some women. It usually goes away after the baby is born, but increases the mother's and baby's risk of developing type 2 later in life. Early warning signs you shouldn't ignore. Now here's the tricky part. Diabetes can develop silently. Many people don't realize they have it until complications begin. That's why recognizing the early signs is critical. Here are the most common symptoms. Increased thirst. Frequent urination, especially at night. Unexplained weight loss. Constant fatigue. Blurred vision. Slow healing of cuts and wounds. Tingling, numbness, or pain in the hands and feet. Frequent infections, like gum, skin, or vaginal infections. If you've been experiencing any of these symptoms, don't panic, but don't ignore them either. Talk to your doctor and get a blood test. How is diabetes diagnosed? Diagnosing diabetes is usually simple. It starts with a blood sugar test. Here are the common tests. Fasting blood sugar test. Measures your blood sugar after not eating for at least 8 hours. A level of 126 milligrams per deciliter or higher equals diabetes. A 1C test. Shows your average blood sugar over the past 2 to 3 months. An A1C of 6.5% or more equals diabetes. Oral glucose tolerance test. Often used for diagnosing gestational diabetes. These tests are quick and can be life-saving. Don't wait for symptoms to get worse. Early detection matters. What causes diabetes? Type 1 diabetes is caused by genetics and possibly an autoimmune trigger, but scientists still aren't exactly sure why it happens. Type 2 diabetes is influenced by both genetic and lifestyle factors. Some of the main risk factors include being overweight or obese, physical inactivity, family history of diabetes, unhealthy diet, high in processed sugars and refined carbs, high blood pressure, high cholesterol, smoking, poor sleep, or high stress. Gestational diabetes is also more likely if you're overweight or have a family history of diabetes. Complications if left untreated. Uncontrolled diabetes can affect almost every part of your body. Over time, it increases the risk of heart disease and stroke, kidney failure, nerve damage, neuropathy, vision loss and blindness, foot ulcers, and even amputation. But here's the good news. Most of these can be prevented or delayed with proper treatment and lifestyle changes. Prevention and management. Let's talk about what you can do, whether you have diabetes, pre-diabetes, or just want to avoid it altogether. Number 1. Eat a balanced, whole food diet. Focus on high-fiber foods like vegetables, whole grains, legumes, and lean proteins. Limit sugary drinks, processed snacks, and fast food. Number 2. Exercise regularly. Aim for 30 minutes a day, at least 5 days a week. Walking counts. Number 3. Maintain a healthy weight. Even losing 5 to 10% of your body weight can dramatically reduce your risk. Number 4. Get regular checkups. Early detection is key, especially if you have a family history. Number 5. Manage stress and get enough sleep. Stress can raise blood sugar levels. So can poor sleep. Take care of your mental health. Number 6. If prescribed, take your medications as directed. Whether it's insulin or oral meds, follow your doctor's plan. Look, diabetes is serious, but it doesn't have to take over your life. With the right knowledge, lifestyle, and medical care, you can live fully and well. So if this video helped you understand diabetes a little better, please give it a like, share it with someone you care about, and subscribe for more content on health, fitness, and taking control of your life. Thanks for watching. Stay healthy, stay informed, and I'll see you in the next one.